having a little discussion here about hypertension. Hypertension is defined as a systolic blood pressure that is going to be greater than, I guess just say blood pressure that's greater than or equal to 140/90. You can divide it into two different ways. You can divide it between primary or secondary, or you can divide it between benign and malignant. So first of all, dividing between primary and secondary, basically what we're saying here is primary is that we don't really know exactly what the cause is, but we have found some risk factors. Whereas secondary is saying, okay, we know what the cause is. Okay, so most cases of hypertension are primary hypertension. In fact, 95% of cases of hypertension are primary hypertension. Only 5% are secondary hypertension. So what are some of these risk factors with primary hypertension? Age is a big one. So older people tend to have it more often. Race, it's more common in African Americans. It's less common in Asians. Obesity is a big factor. Typically, if a person is obese, they have a body mass index above a certain level, then they're more likely to have it. Stress, if a person reports having a lot of stress in their life, that's also a high risk factor, as well as low activity. If a person doesn't get a lot of physical activity, then they're at higher risk to have primary hypertension. And lastly, people who have lots of salt in their diets. So the case of secondary hypertension now, so 5% of cases where there is an identifiable cause, typically a lot of times it's going to be from renal artery stenosis. What I mean by that is you've got this artery that goes in and it's going to feed your kidney, okay? So if this thing gets stenosed for some reason, which means it gets kind of like almost like pinched off, not letting much blood through there, then what's going to happen is the person in their kidneys is where renin is released, okay? So if it's not getting much blood because of renal artery stenosis, then their kidneys are going to start to release a lot of renin. And if a lot of renin is released, then the renin is going to turn a lot of angiotensinogen produced in the liver into angiotensin 1. And if there's a lot more angiotensin 1, then it's more likely a lot of the angiotensin 1 is going to be converted to angiotensin 2 by angiotensin converting enzyme. And if there's a lot more angiotensin 2, then angiotensin 2 goes down to the blood vessels and it causes them to vasoconstrict. It also triggers the release of aldosterone. Aldosterone is something that holds on to salt. If you hold on to salt, you're going to hold on to water. If you hold on to water, you're going to get high blood pressure. Okay? So that's what's going on here. A lot of times, secondary hypertension is going to have a unilateral kidney atrophy sign. So one kidney is going to get small, okay? And this is caused by, a lot of times, this is as far as what's causing this stenosis, be atherosclerosis, that's usually in older men, or it can be fibromuscular dysplasia. In other words, you got these different layers in your blood vessels, right? And there's this, the muscular layer becomes dysplastic. When it starts growing out of control, grows the wrong kind of stuff in here, and that kind of cinches down on it. And that's usually typically found in young females. So the atherosclerosis, usually in older men, fibromuscular dysplasia, usually young females. Okay, so what about the benign versus malignant? And we already divided it by primary versus secondary. Now you can also divide it by benign versus malignant. Benign versus malignant. Benign is usually it's going to be a mild increase in blood pressure elevation. It's usually clinically silent. It means it's high, but the person isn't really feeling many problems from it. Also, the vessels and organs are slowly damaged over a long time. Whereas in malignant, this is going to be a severe increase in blood pressure. Like I'm talking greater than 200/120. This is going to have cases of acute renal failure. You're going to have a headache, papilledema, and this is considered a medical emergency. Sometimes malignant can come from benign, the person can already have hypertension and it just eventually becomes malignant, or it can just kind of come out of nowhere. And that is hypertension.